Hey, Future Gen, Dr. Stan here, coming at you with our theme of the month for May. Holy cow, May. It's mental health matters, especially for kids. Mental health matters for kids. And I can't tell you how important this is. At the end of the day, what I know for a fact, because I've been studying this for so long, neurobehavioral, neurodevelopmental, but especially mental health challenges have been skyrocketing in the last year. And so if you haven't seen this before, prior to this last year, it was already an epidemic. It's already an epidemic, and we only have off-label drugs and things that are not really tested, and there's no objective measurements for mental health challenges, and they're passing out psychotropic drugs, antidepressants, anti-anxiety, antipsychotics, anti-seizure, all these different medications for challenges that they have no concept of how to even identify anywhere close to the root cause. And so for me, what I understand for a fact, because I've been studying this for so long and I've been watching it very closely over the last year, I've heard, and you've seen me say this before on my social media, which was deplatformed, that suicides, domestic violence, child abuse, drug use, alcohol abuse, all these things have been on the rise for all populations. But what was most alarming for me, studying how disease trends and top 10 reasons for deaths for so many years, is that once you hit that teenage mark, suicide's the second leading cause of death. You need to understand that that is not in any way an example of a vibrant society or anything that's remotely acceptable. And at this stage, what I know for a fact also is that over the past year, those numbers and those statistics have amplified in a way that is astronomical. To this day, I just had a patient tell me recently that because so many of her friends' kids have been suffering from anxiety, that doctors and pediatricians are like, I will not sign a mask exemption for you, because it's when that amplifies for them. They put on a mask, their anxiety goes through the roof. They say, here's an anti-anxiety drug. Nowhere in the history of healthcare has that ever been acceptable until this last year. And so what I've been saying unequivocally for the last several months is that the tsunami of mental health challenges, the tsunami of neurobehavioral disorders, the tsunami of neurodevelopmental disorders are all coming. And they're all coming, and it was already a tsunami, and now it's exponentially greater than that. So what I want you to know is that when you read the newsletter, you read the blog, and you read all of our information that we're putting together for you, is that there's so much hope. There's so much hope. It's just not in the conventional healthcare system. It's not in conventional pediatrics, because until you try to look for the root causes of challenges and help the internal resilience and the internal adaptive and the internal compensatory systems of the body, you're just going to continue to paint over the rest that's just destroying the bodies of our kids, the bodies and minds of our kids. And so at the end of the day, if you're looking for answers, don't look at them at the bottom of a pill bottle. Don't look for them at any sort of prescription level. I would even go as far as to say that please don't go to a doctor that basically just says, here, take these. Because if they're just giving you something without trying to figure out what's actually at the root cause, I don't think that that's any way moving forward for anybody in healthcare, but especially kids with mental health challenges. And so here's what I want you to do. I want you to share this newsletter with somebody who you've heard already, or who maybe you even lovingly suspect has a kiddo that's struggling with their emotional and mental health, because it may be the key for them to realizing that there's other possibilities, that there's hope for them, and that there's a community right here in our four walls that's ready to stand by and serve and stand up for your kids' rights. Thank you for tuning in. Enjoy May. Enjoy this beautiful, amazing San Diego weather today, but May gray may be upon us too, right? Thanks for tuning in. We'll see you next